Okay, so that passes 8-1. I just want to thank everybody for being here and for tuning in tonight. We are meeting at Mallard Creek High School in the auditorium. We're masked, we're social distancing, but a lot of people have pointed out that if we're even considering an option that brings teachers and students back into classrooms, that we need to be together as well and not be on Zoom. So that's why we are doing it this way. But at the same time, there are still public safety restrictions on the total number of people that can be in a room at a gathering, and there's quite a few of us when you count all the presenters as well as everybody around these tables. And so that was why we were not able to open this up to the full public. So we're still streaming. But anyways, that's why we're here with masks instead of on Zoom today. We're now going to have a Mecklenburg County COVID-19 update, and I turn to the superintendent for this update.
Thank you, Madam Chair and board members. Good evening, everyone. I would like to invite our dear and close partner, Ms. Gibby Harris, who heads our local Mecklenburg County Public Health Department, to share some words with our Board of Education and members of our public, and then also give our board members an opportunity to ask any questions of Ms. Harris. Harris.
About this. Oops, sorry. That helps, doesn't it? That's almost too loud. So there's nothing. The guidance, what we understand about this virus, continues to change. We continue to learn, and we continue to have to change our guidance and the way we operate based on what we're learning as we go. And that's been true for the school systems as they've been planning, trying to think about what this fall would look like. When you think about reopening schools, there's all kinds of issues that impacts. There's issues of our parents and those folks that need to work. There are issues that I'm concerned about with a number of our kids who will not get the instruction that they need if they stay at home just because their parents aren't able to provide it for one reason or another. And there are concerns about parents being able to work. But there's also the concerns that I understand you're hearing from teachers and from the people that work in the schools about their safety. And the list goes on. The list goes on. And we all have had numerous conversations across the country about our concern for our children and whether they're able to learn well in the virtual environment. What we're seeing here in Mecklenburg County, and it was in the data that I sent to you, hopefully you got it today. Those trends include the positivity rate, which is the number of positive tests based on the number of total tests that are done in the county. Unfortunately, that number is not perfect because we don't get the total number of tests from some of the testing sites. So we're using data from our two hospital systems who do most of our testing, and we look at their positivity rate. Our positivity rate has been hanging around 10 to 11%. It's not good. We want it to be lower, but it's been somewhat stable in that area. Some days it goes up, some days it goes down. We look at it over a 7-day average. So we're watching. It's staying fairly stable. We're testing a lot more, so we're seeing more positives, which you would expect. But the positivity rate is staying fairly stable. We also look at the hospitalizations that we are seeing. Those hospitalizations have been ticking up since the middle of May. It's been a slow rise, sort of a steady rise. Our hospitals have been able to manage it to this point. They have very specific plans in place, and I know you have some folks from both the hospital systems coming a little bit later this evening, so they'll be able to talk about some of that in more detail than I can. But we watch that data on a daily basis as well. We look to see how many patients total they have in the hospital. We look to see how many COVID patients they have in the hospital. We look to see how many of those are in ICU beds and how many of those are on ventilators. And to date, the hospital systems are managing that well. Luckily, over the last month or so, their census rate has gone up, but it's because they're bringing in those folks that had been putting off health care because they were afraid of coming into a facility and getting COVID. So these folks are coming back in, they're getting the care that they need, elective surgeries, those sorts of things. But the hospitals have the capacity to close that back down again if they need beds for COVID. They also have surge capacity. So we're watching all of those things very carefully as well. Obviously, we have not seen, at least at this point in time, some of the things that are being seen in other parts of the country, especially the South, where the rates are going up significantly and hospital beds are being filled. Another thing we watch very closely is the number of influenza-like illnesses that are seen in our emergency departments across the state. Typically this time of year we're not seeing a lot. We're still not seeing a lot right now. It's higher than it has been because COVID is sort of being pitched into that number. Typically we see that go up significantly once we get into flu season. So flu season is the one thing that has me terribly concerned. I think once we get into flu season, we're going to need to make sure that we get as many people vaccinated as possible because it just complicates the whole issue with COVID. Because when you've got a child in a school or you've got somebody at work and the symptoms are fairly similar, there's some differences, but there's similar symptoms for flu and COVID. You're not really sure what you're dealing with. So those are some of our issues right now. The other concern that we have is testing and having enough testing available. If we, as we open up schools, whatever decision that y'all make around that, I would love to have rapid testing available so that if a child or a teacher or someone that works at the school becomes symptomatic, we can test and know immediately what we're dealing with and manage it quickly. That would make a huge difference in the school setting. Right now, we don't have ready access to that. We did have the CDC director here earlier this week, and we talked to him about that. He is pushing hard to make that rapid testing available, readily available, because he knows that schools need to open. But I can't tell you when that's going to be available to us. It's something, again, we have to watch. So it's all part of that evolving world of COVID-19, which makes it challenging to make decisions because so far nobody's crystal ball has worked very well. We make decisions based on the data we have and what we're seeing in our communities. The other thing that I will mention as well that we have experienced here in Mecklenburg County, the governor creates his orders and his guidance based on the entire state. Mecklenburg County doesn't look like a lot of the state, and we have much higher numbers than anyone else in the state. And that impacts how we take his guidance and translate it into action on the ground. So I know as you make your decisions, you will do the same here because his guidance is important for the whole state to have, but then we have to customize it to make sure that it works for Mecklenburg County. So I will stop there. There's much more I could say, but I think I'd rather allow y'all to ask me any questions that you might have that might be helpful in your deliberations this evening.
Thank you. Before we go to questions, first I just want to thank you for making the time to join us tonight. This is incredibly important for us to have some time to ask you questions like this. How much time do we have with you, just so I can make sure we use that wisely?
I am good until about 6 o'clock. I've got a webinar I have to be on at 6:30 this evening.
Okay. Well, we won't take that much time, so we have a lot more to get through.
Yeah, you do.
Colleagues, let's do one round of questions, and then not everybody has to ask a question, but if you have a second question, let's give everybody a chance first and then do a second round. And I see Ms. De La Hara.
Thank you, and thank you for being here with us this evening. My concern is about the testing, and you mentioned that the CDC director, you had encouraged him, or he was encouraging that we move with more rapid testing.
Mm-hmm.
Can you explain any more? Like, did he indicate what the challenges were, or if he had any dates or information, and how that would be funneled to you when we do have access?
We don't have any of that right now, unfortunately. One of the challenges we're having right now is with the increased testing we've been doing, the labs have been backing up. So the turnaround time on testing has increased, which is not good. I mean, if you get tested and you can't get test results in 48 hours so that you know what to do with it, it becomes a problem. And right now, some of our test results are coming back in 5 to 10 days. So I do know that at the federal level they are working on it. They have a platform for doing it. The question is how quickly they can ramp that up and then get it out into the communities, and we've really not gotten much information on that yet. He understands that that particular type of testing is critically important to how well we can manage opening schools. So I do know that they're putting a lot of emphasis on it right now, but we've had challenges with testing around this virus so far in this country, so it's hard to count on it at this point.
All right. Ms. Schiff? Microphone.
Thank you so much for being here. I really appreciate it. I kind of have a similar question, but want to know, as we talk about we don't have the testing availability, what would you think that protocol should be in the schools? Because the first time we have a child, if we're talking about even temperature checks, and we know that's not as valid, but the first time we have a situation with a child that's sick or a teacher that's sick, what would you recommend in terms of protocol? What should that look like as a school begins to see this?
So that's a good question. I think the first thing I will say is I think one of the things that helps us in this county is that we have a fairly robust school health program. So you will have nurses in your schools that can respond to those types of situations, and will have worked through with the school what the protocol is. Typically what we would recommend in that situation is removing the teacher or the child from the classroom immediately if somebody develops symptoms while they're in the classroom. And at that point, depending on how ill they are, of course, we'd contact the parents and try to get the child tested right away. If it's a teacher and many people have mild symptoms. They're not severe. And that teacher could get in the car and go straight to a testing site and get tested. So that would be the first thing we'd recommend, is let's get a test done as quickly as we can. As soon as we get them out of the school environment, get them tested as quickly as we can. And that school nurse, most of our school nurses have been doing case investigation and contact tracing this summer. So they've got lots of experience with that, and they will have access to the systems that they need to get these things done.
So we would definitely need to have a nurse in every school working with this, and then that contact tracing is important. Would we then begin to decide how many others would need to also be moved out of the school to go for testing as well?
Exactly. And one thing I will emphasize, and this is what we're doing in our work environment as well as working with law enforcement and fire and rescue, and even with the hospital systems, if people are masking appropriately and social distancing, it really cuts down on the number of people that you have to worry about in terms of contact. And I think that's the point that I've been trying to emphasize. I mean, several things that we want to happen. We want our hospital systems to have the capacity to deal with the individuals who are sick. We want people to be able to work, and we want kids to be able to go back to school. And if we do the things that we know we have to do, we can make most of those things happen. So if people wear masks and social distance, don't get involved in large groups, and do what you need to do out in the community, but don't go to bars and restaurants until the middle of the night with a bunch of people without masks on, or get into large congregate meetings with people without masks on. There's things we need to do, and the reality is this virus is not going away. It's going to be with us for a while. Unfortunately, it would be different if we had a vaccine or a cure or treatment even. We do have some treatment, but not a full spectrum of treatment. But we don't have those things right now. So we have the majority of our community who still is vulnerable to this virus. So that being the case, we have to do the things that we know that work. And those are the things that we know that work.
And would we send out letters? I know in the past we've done that. I've been in the schools as administrator. Would we design, because this is important too, a letter that would then go home with the rest of the people who would come in contact with that, especially to the children and families?
Yes, if there's a situation where others have been exposed, we would be notifying them just like we do with any other communicable disease in the school system.
Just wanted to verify that.
Okay. Ms. Sawyer, and just FYI, colleagues, if I don't see you, make a noise or something, because I'm having a hard time seeing everybody.
It might just help a little if you could just go around the circle.
Okay. Did you have your hand raised? Okay, Ms. Chi?
No, I'll go ahead and start that one.
Okay. Ms. Sawyer?
One of the challenging things from a decision-making perspective is that while some states have given specific guidance on metrics that are for in-person school, others have not. The state of New York, I'm sure you're familiar, has set a target, which I guess is consistent with our positivity rate. They set a 5% target, and we're now twice that. Are there other metrics that you would look at to assist in decision making, or is there a point at which, is there a metric at which you would say we can't have school? Is there a point at which you would say absolutely schools need to close, and what would that be?
I don't have a specific number at this point. What I would tell you is if we see our positivity rate starting to climb, if we see significant increases in our hospitals, even though they can manage it, that just means we have more people who are ill and need to be cared for. I would be concerned and would think that we would need to start having conversations. The reality is, and I've been working with the school staff for quite some time on these issues, and I work with businesses around this issue. I work with others in the community who are trying to open up lots of different things, and I said, happy to work with you on your plans, and we can have best case scenario, middle of the road, but you've always got to have that contingency plan, and you've got to be able to put it in place rapidly if we start seeing issues. So it's important to have all of those plans in place. I think that, 10% has been sort of in the country has been the number that you don't want to get much above 10%. But we're seeing places right now with 25 and 30% positivity rate. We haven't come anywhere close to that at this point, but we watch it very closely.
Okay, thank you.
Mr. Schul, do you have any questions?
I was just wondering if you could maybe offer us, quantify exactly what is the risk of students staying in a classroom for 8 hours in a closed environment with masks 6 feet apart? Is there an increased risk compared to what we're doing right now? Maybe just some guidance about what is the risk looking like? What are we getting ourselves into?
Well, the studies that we're seeing right now, I mean, as you know, especially if you've worked in a school setting, that children with most upper respiratory infections are super spreaders. Talk about the flu, you talk about colds, you talk about all of those sorts of things. Our children are super spreaders. It goes through classrooms, it goes through homes, and the children quite often are what's bringing that back to the homes. What we're seeing with COVID-19 right now is that children are not proving to be super spreaders of COVID-19. This virus has been very different than most of our respiratory infections that we deal with on a regular basis. So we're seeing that children are not necessarily the super spreaders that we thought they probably would be, because that's what we experience with other viruses. Probably the bigger concern in a school setting right now, well, number one is you have the challenges of children wearing masks all day long. I know my granddaughter is going to be a real pill for somebody to have to deal with, because I doubt seriously she's going to gladly wear a mask all day long. But I think if we definitely need to protect, but also to keep teachers and other staff masked so that they're not introducing anything into the school setting as well. That's just as important. So I think if there's social distancing and the children are masking, based on everything we've seen so far, that's the assumption at this point. We might learn differently by some places that do open up and bring kids in, but right now, based on all of the evidence and the research that's been done, that's what we're seeing. But there's a lot of ifs there. I understand that.
Turn on your mic.
The other night I was watching TV, I think it was 2 nights ago, and I've been watching the what do you call it, the rate, just kind of meander. And I don't know if somebody put the wrong map up, but it looked like that thing had jumped, and it scared me. And it scared me because I knew we were going to be having this conversation. And the next night, I guess which was last night, it didn't look like it had gone back down. I don't know if it wiggled up a little bit, but it... and that thing can change from day to day. So we can sit here tonight and make a decision based on the testing today, and then tomorrow it could jump. And then we would... how do you think we should evaluate what you're saying? You're telling us it's fairly stable right now, and then we go home and the news reports say something different. And I'm looking at local news. I'm not paying attention to the national news or what the other guys are doing. I'm looking at local.
I will point out that one of the challenges we have is our data, because the state reports the numbers and we report the numbers, and they don't always match up. So that's one challenge we have, and that's a reporting artifact. The state gets the positives for anyone who tests positive in Mecklenburg County. There are quite a few people who test here who don't live here. We track residents because that's who we're responsible for. So our numbers look a little bit different from the state numbers. Sometimes you'll see the Charlotte Observer, I think, had us having 400 cases 3 days ago at residents. Those were the positive tests going up and down fairly significantly because it depends on how many tests were done on a certain day. Some days, the systems that test in Mecklenburg County test more people than other days. When you have more people being tested, you're going to get more positives. So that number bounces around a lot. That's why when we look at the positivity rate, those tests done are positive. And then we average it over 7 days. That gives us an idea of how that trajectory is working. And when I say stable, down every day, it's that 7-day average of what we're seeing.
Now, you were saying the testing, but if you're talking about just the tests that happened today, you won't get the results of those tests. You just did a test.
Yeah, and so what we report are the tests that we get in. So that's the other challenge we have, is the way the system works is the person gets tested, it goes to a lab, the lab results it, they send that information to the state, so there is a little bit of a lag there. It's improving some, but there is a little bit of a lag before that gets back to us, and that's what we can report.
So the rate that I'm seeing tonight was what really happened a week or more ago.
It's possible, some of it, unfortunately.
Thank you.
I'm going to remind us all to kind of keep your microphone near your face. We got so used to Zoom, we're forgetting how to use mics, but some people around the table are having a hard time hearing, and I've heard that folks watching us at home are having a hard time hearing as well.
Thank you.
Turn your mic on.
And tip it down toward your face.
This is the analog.
Classroom
Put yourself off mute.
environments are important, and our schools are at various levels in terms of age and health. And quite frankly, I visited some of our schools that you can't open windows, the HVAC is not in good shape. Talk to just a bit about the type classroom environments would be considered the safe environment for children.
You make a great point. It's important that the HVAC systems work well in the classroom. I haven't had specific conversations with staff about where there may be concerns around that and that sort of thing. I know that there's work that's being done to try to improve where there needs to be improvement. But, you do want good air circulation in the rooms. While even though you've got masks on, you just want that circulation in the room. So the perfect environment, obviously, is an environment where people are 6 feet apart the majority of the time, and that everybody has a mask on, that the HVAC system works well, and that there's not a lot of sharing of stuff. That's the optimum situation.
Thank you.
All right, Mr. Strange?
So thanks for coming out. It was really important for us to have this conversation in public with you, to really understand in terms of our public health, our regional public health, what that looks like, not just in the county, but around a bit as well. And this virus knows no boundaries.
Exactly.
Neither does any other virus, if I'm correct.
That's correct.
So what I've heard you report is that the positivity rate is staying relatively stable. What does that mean? I understand the words, but what does that mean in terms of the health of the people of Mecklenburg County?
It's a mixed message. I'll admit that. Unfortunately, it's the best we have right now in terms of data that we have available to us. One of the other challenges with this virus is that there are quite a few people who are asymptomatic or have very minor symptoms who are still shedding virus. And many of those folks have not been tested, don't know that they're infected, or that they're potentially infecting others. That's one of the challenges with this disease. What the positivity rate tells us of those people who are being tested, that the percent of those that are positive, that's the positivity rate. It gives us sort of it's a surveillance tool to help us try to figure out to some extent what's going on in our community. The fact that so many people are infected and asymptomatic has made this particular virus a little challenging to understand fully and to track fully. The only way to do that as well as we possibly could would be to have a lot more testing available in our community. And we've been trying to increase the testing in Mecklenburg. The state's been trying to work with us on that. But if we can't get the turnaround time on test results down to a level where it's reasonable, it doesn't make really need to be tested.
Sure.
So we're in it is, like I said.
Sure. So if I understand it correctly, if we double the number of tests, test twice as many people, and the positivity rate went down roughly in half, all that's telling us, so the positivity rate that's being tracked would have been cut in half, but it wouldn't change the health of the public at all. Is that right?
So here's how I would frame that. Again, what the positivity rate tells us is gives us some idea of the percent of our community that's infected at any given time. I have said more than once that we are not going to test our way out of this. We are not going to test our way out of it. If we have it in a timely fashion, is help us be in touch with people who need to isolate and quarantine so they can't spread it. That's what it does for us. The only other thing that testing does for us is, from a surveillance standpoint, sort of understanding what's going on in our community. Things that we have learned is, that we have certain populations that are more impacted by this right now than others. And that gives us an opportunity to do more education and to make sure that testing is available in that community. But it doesn't tell us fully what's going on here, because we just don't have the testing available to do that. But testing alone is not an answer to anything other than just giving us an idea of how many people might have it.
Right, and I think that's what I'm trying to understand about that positivity rate. If we did have an opportunity, and we're certainly, as you described, making every effort to increase the level of testing, the expectation is we would increase the level of testing. It doesn't change the health of the population at all.
No.
But if you increase the level of testing, the expectation is that the positivity rate would go down. But that doesn't change the actual health of the public at all. Right?
The health of the public is going to be changed by all of us doing our part. Wearing masks, social distancing, washing your hands. I mean,
right.
that's
our behavior, right?
Exactly.
As a public, it's down to us to change not the positivity rate, but the health of the public.
Exactly.
And whilst it's some indication of the health of the public, again, it's also completely dependent on how much testing we're doing. If we cut the tests in half and targeted those tests, then the positivity rate would go up. But it also wouldn't change the health of the public.
No, it is.
Right?
It is a measure in time,
Yep.
and it is. It's not the only measure we can look at. I mean, it's not going to give us an answer.
Okay.
We have to look at more than that.